Morning. Hi, this is Dr. Robert Fromm again from West Side Family Dental. Today, we're going to talk about porcelain fixtures for your teeth, how we restore teeth with porcelain. Now, there are three ways to restore a tooth. Going from more conservative to less, it's filling, onlay, and crown. But today we're going to talk about the difference between onlays and crowns, or inlays and crowns. The difference is when you do a crown, you have to cover the whole tooth. Imagine a hat covering the tooth. Well, that means we have to prepare the whole tooth, which means grind the tooth down all the way on the top and on the sides. So there's a lot of tooth reduction. Why do we do an onlay? Well, an onlay saves tooth structure. If you're missing a part of the tooth that's too big to fill with a filling, but not big enough to cover with a crown, we can be more conservative and save tooth structure. And that's always what we want to do. We want to save as much tooth structure as possible. So imagine if you're missing maybe a part of the tooth, one of the big bumps on your tooth, or maybe about a third to a quarter of the tooth. Well, that's too big for filling. That's where an onlay comes in. Imagine that an onlay is a puzzle piece that fits onto the broken part of your tooth. It's very conservative. You take this piece and you cement it in, and the tooth looks normal again. This is also what happens if the filling or the preparation or the cavity of the tooth or the broken part of the tooth goes a little bit under the gum. When you have a filling or part of the tooth that's broken and it goes under the gum, you can't do a filling. You can never keep it adequately dry. And so the filling will never set in an area of moisture. That's when we use an onlay, and that's when we use a crown. But again, if you want to be more conservative and your dentist tells you need an onlay, remember, it's a puzzle piece, fits in the tooth, and makes it look normal again. Again, this is Dr. Robert Fromm from Westside Family Dental. Thank you.